When we are looking at placing implants, we all want success. We'd love it to be 100%, but unfortunately it isn't. When we look at the research that's available regarding success, we are seeing between 95 and 98% success rates over 10 to 15 years. So if we follow a certain model, some prerequisites, then we're pretty certain that osseointegration is a given and that the implant is going to integrate. But there are certain steps that we need to take in order for us to achieve that. And one of those is that we can achieve primary stability of the implant. So this term is used and it's given to when the implant is first placed in our osteotomy. And we can measure that using the hand wrench or the machine. And we can record it as, well, I record it personally dichotomically in either poor or good. You can also record the torque value. But it gives us an idea that that implant is going to be rigid and stable, and that it's not floating around, and that it's actually in bone and it's nice and solid. And that gives us a better chance of success if we can achieve that. And then the other aspect is that we are always planning our implants, and we are doing it in what we term prosthodontically driven. So we're always planning our restoration and ensuring that we can restore any implants that we place before we place the implant. So there's a lot of planning that goes into the implant process before we actually do the surgery. So you can take impressions and send these to the lab and do diagnostic wax-ups and have a stent made so that you can understand where your osteotomy is going to go. Or you can do it digitally and you can plan it using your CBCT scans and other software, and you can place your tooth or your dentures and have a look at the position of your implants and where the access hole is going to come out of, and then determine whether or not you're going to need to graft or augment or not. And then the other side of things is to ensure that we respect what we're working with, which is the bone. It's a living tissue. It's not dead, it's not wood, it's alive, and we have to respect it. So there are certain protocols that we have to follow when we're drilling the bone, so that we don't overheat it and cause bone necrosis. We don't put the implants in under too much stress, so we don't over torque them. Again, the bone doesn't like that, and it'll disappear from around the implant. So there are lots of aspects that we can ensure that we do and follow these protocols to achieve success. But what we often find is that when we are placing our implants in the ideal prosthetic position, that the bone volume can be inadequate to cover our implant. And if we don't achieve coverage of bone around the implant, then it can